Thank you. Welcome, everybody. My name's John, in Mombasa in Kenya, a member of IACD, and it's my pleasure to facilitate today. We've got a great team of, I think, four from Women Challenge to Challenge, and this is an organisation in Kenya, led and run by women with disabilities, and it's been my pleasure to work with them and to consider them my friends as well for many years. So it's really an honour to have them here with us today. So they're going to be sharing some insights into the work they've been doing around advocating for the rights of women with disabilities, and also sharing some of the impact stories of what they've been doing over the years. So we're going to start with Jane, who is one of the founders and the executive director of WCC, Women Challenge to Challenge. So Jane, over to you, and welcome.
So, good morning, everyone.
Morning.
Thank you for having us here, John, and introducing us to the team. And I wanted to learn more about inclusion, and especially how do we bring in women with disabilities into our work. So, because I understand I have a few minutes, like 7 minutes, I'll just talk briefly about WCC, how it was founded and why, and then Jacky will talk, and maybe Sense and the rest will say the rest. So I want to start by giving statistics of the Kenya's situation. According to the census 2019, persons with disabilities are 2.2%, and that is lower than what the World Health Organization gives, that 16% are persons with disabilities in any given population. So Kenya, there is that problem of data already of persons with disabilities. And that data shows that men with disabilities are 1.9%, while women are 2.5%, and majority of them lives in the rural area. So really, given that, even if the number is lower, it is a number that we cannot ignore, for any development. We cannot ignore this number. And so we are saying women with disabilities will face multiple layers of discrimination based on their gender and disability. And because of that, that is how we came about with the WCC, Women Challenge to Challenge, which is a national organization. And our aim was to bring women together and be able to address the issues that affect us in our daily life. And one of the issues that we see is lack of inclusion, lack of being involved in the development, that leaving us behind. When we talk about women, we talk about women in general, but then we forget the intersectional part of development, that there are other section of women who are likely now to be more affected. And so WCC comes about to give the lens of intersectionality to address those unique issues that will affect a woman with disability and not necessarily a man with a disability. So in the empowerment programs, what do? We focus on the issues of sexual and reproductive health and rights of women with disabilities, because we saw there is a gap when it comes to access, when it comes to information, physical access, accessing the facility itself. There is also a problem of the communication, getting that information. There is also attitude part of it that makes women with disabilities not access reproductive health and health in general. So the other issue is that we have identified is that women with disabilities are more likely to experience gender-based violence. So this is also an area that we focus on. We do work with civil societies, the government, and women with disabilities on coming up with the prevention and protection and response mechanism on how to make women with disabilities access the services that are available there. Issues of leadership and governance is also something we do as WCC. How do we bring women into the leadership of this country, into the leadership of their networks, and that we have done through other programs that Jacky will talk about. And the other thing is that we have identified that women with disabilities have no economy autonomy. They depend on other people. They don't make choices about the economy. And this is contributed by different factors because of discrimination. Some do not access education. And therefore, when you have no education, getting that employment also become a problem. So all those limitations that will pose barriers to economic development of women with disabilities is an issue that we also address. So I want to end there and say that WCC mainly is there to take that human rights approach, change people's perspective about women, and give women with disabilities a voice to speak for themselves, to be able to participate, to get involved. And so what we are saying is that inclusion, as much as we talk about it, it's not an event. It's not one thing time. We can do it just once. It is a process. It is a system. We need to make our system more inclusive, and we need to speak about women with disabilities, not only make it as like one thing that is happening today, and then tomorrow we are not doing about inclusion. It is a process. It's a continuous process that we have to engage with. And so I want to appreciate this opportunity and to know that we have other allies when it comes to inclusion of women with disabilities. Thank you.
Thank you so much, Jane. Really, really appreciate having you here today. Okay, so over to you, Jacky, for the next part, and welcome to the mic.
Hello, everyone. Please confirm that you can hear me, John.
Yeah, no, that's okay. Yeah.
Okay, before we invite the people that you have been working with, especially at the community level, allow me just to take you through what we have, just to add on what Jane has said. And my name is Jacky Wangeci, and I work for Women Challenge to Challenge as a program manager. Yeah, and I've been working on disability justice for the last 10 or so years. And let me say that I've really learned a lot, because even before I joined WCC, I must confess that I had not interacted with persons with disabilities, leave alone women with disabilities. So it has really been a learning curve for me, starting as a novice, if I must say, on disability justice and being inclusive for women with disability. It has been quite a journey which has made me learn a lot. I continue to learn a lot through women like Jane Kiwungi, Millicent, Charity, who is here with us, and so many other women that I meet out there, especially at the community level, because our core mandate is to reach the women with disabilities at the community. Because we've come to notice that from long ago, and even now, most decisions are made on high tables, if I must say. Like, people might forget the issues of women with disabilities while sitting in those decision-making tables. But then, as Women Challenge to Challenge, we are there to ensure that the voices of those women with disabilities in the community, in the grassroots, right down there in the villages, are able to be heard, and they are able to take part in the decision-making in their own small or big way. So yeah, the next let's go to another slide, John. So what we've had so many successes, and I think it was hard for us to just compress it into slides. We'll be able to hear more as we continue in the short time that we'll be presenting, but we are open even to more discussions, even with the people who are here, to get to know where we are coming from and all we have done, because we have really done a lot when it comes to community advocacy for women with disabilities. And in our work, we have reached, I think I did an injustice even to say 600, because it is way more than 600 women with disabilities. And because in the Awesome program, which we have talked about in the concept note, we reached more than 800 women with disabilities in our advocacy over the 5-year period that we were implementing the program. And what we do, we train the women with disabilities right in the community on how to be self-advocates, how to speak on themselves, because even as we sit at the Nairobi offices, WCC, we have those community mobilizers like Charity and Millicent, and we are in over 30 counties. So those community champions, community mobilizers, we have been able to train them on advocacy, so that even if WCC is not there, even if Jacky or Jen is not present in those counties, in those villages, they are able to self-advocate, to be able to talk about their rights, what is rightfully theirs, whether when it comes to leadership spaces, whether it is on sexual and reproductive health rights, whether it is on issues of sexual and gender-based violence, economic empowerment. They are able to speak out, even when someone, for example, when a woman goes to hospital in the counties, and maybe they don't have a sign language interpreter, or one is not provided, maybe it's not the hospital is not accessible. A woman with disabilities, what we want is that woman with disability to raise that, to speak out and say that I need to move from point A to point B. Where is the ramp? And how accessible is the ramp even? Because we have seen a trend where, yes, as an institution will put a ramp for a person with physical disability, but then that ramp is not accessible even to the woman with physical disability, because it has been constructed in a way that woman cannot use it. So yeah, when it comes to sexual and gender-based violence, the community, people that we have trained on advocacy, if there is a case of violence of a girl with disability, they are able to follow up on that case from the time it has happened, ensuring that evidence is not destroyed, talking to the healthcare providers on what needs to be done, and even the policemen, the chiefs, the village elders in the community. So our joy is to see this, or our fulfillment is to see these women with disability being able to speak out on themselves. When it comes to public participation, because we usually have this public participation called out by the government, like recently in Kenya, around November, there was, because we have been having issues, cases of femicide, and it does not affect the women who do not have a disability only, but it also affects women with disability. So what is the role of those women with disability in the community when it comes to such public participation forums? We have at least, because they are empowered, they are able to participate in these public participation forums. We do not have to go there, as much as there will be some, or there are some in Nairobi County where we can participate, but we want those women with disabilities to be able to talk and raise their concerns in these public participation forums that are being called by the county government. Other public participation on the county, like right now in January, as the year begins, on the county plans, budget plans, we need those women with disabilities to be there to talk about how the budget should be allocated, how the items should be allocated to meet the needs of women with disability, and not women with disability as a whole, but also specific needs of specific types of disability. Yeah, another success I can talk about is the tremendous work we have done with the county hospitals and the county hospital. And maybe for those who are in other countries, Kenya has 47 counties, which within the counties we have the sub-county. So through our partners, we have constructed friendly disability toilets, especially in the maternity unit, because that's where the real, like, the services of sexual and reproductive health rights in the maternity unit may come out. The women with disability may need to have such friendly toilets and washroom so that they can be served better, and they can get these accessible things. So we have constructed in the past 4 years, we've had six hospitals being having the maternity units with friendly toilets that can be used by women with disabilities. We've also purchased disability-friendly beds that a woman with disability, even as he goes or gets admitted in the hospital, even during delivery, they are able to move freely or to get to the beds freely without really depending on someone to come and lift them, because that's a whole other thing to talk about. Even when these women with disability go to the hospitals, and the hospital don't have these disability friendly beds, accessible beds, most practitioners, the first thing that comes to their mind is to lift the woman, but then is she comfortable with that? Sometimes even asking if you can do it is really quite something. So having just that disability friendly bed for her to be able to just climb up with dignity and by herself really does a lot. So those the toilets are in those sub-county hospitals and in county hospital. The next slide, please. That's a photo of one of the women with disability in a county called Nyandarua, who participated in a public participation forum called by there's a technical committee which was set up by the president last year to get findings on the femicide issues that were really rampant in the country last year. So we supported 26 women with disability, this one being one of them. She's one of the community leaders in Nyandarua County. And I think it's a proud thing for us. It is an accomplishment for us to see such a woman with disability being there, speaking boldly, and what she's speaking is being taken into consideration. Yeah. This is Kilifi County. These are some of the women with disability and county government staff. We just to mention just briefly, we worked with this county to support in developing a disability inclusive, an anti-GBV policy that is inclusive to persons with disability, not necessarily women with disability alone, but even persons with disability, because our interest is to see those issues coming out clearly, even in the policy documents. Yes, John? Some of our lessons that we have learned, and I think in the first point, Jane has tried to speak on it, that when it comes to inclusive advocacy work, what we have learned over the years is that this is not a straight line work, if I must say. Like, you cannot really follow a path and say, I'm starting from point A, and there's a specific line I will follow, there's specific things I will do. We've learned that it needs a lot of patience, that some things might change. We might be open-minded. We must be open-minded to see things differently when it comes to disability, especially for women with disability. Because as we go on with our work, we have seen that we have to change even attitudes. And it takes quite a lot of time to change the attitude of someone when it comes to disability. Let me give myself as an example. Coming to WCC even as a very green person, it took time for me to understand disability and to understand women with disability issues, and to be able to just champion their rights and talk to the community, talk to the county leaders. I must say that it takes time. So we cannot give ourselves a timeline and say we must finish this work at this time, like on this date. We have to be open-minded to know that there are some many things that come into play. Some we are prepared for, some we are not prepared for, and we have to be flexible enough. We have to be persistent in our work, because we meet some minds which do not really are not ready for that change. So yeah, I must say that it is not a straight line. Like, let me give an example. Just recently in the Awesome program in Kilifi County, when we were sensitizing the communities on the Kilifi anti-GBV policy, because we needed the women with disabilities in the villages to know about this policy, to know that there's a policy that addresses their issues, and there should be accountability. They should be the advocates to make the government be accountable on what we have said in the policy. So when we were doing the sensitization in the communities and villages, we went to right deep into the areas which the terrain was not all friendly. It was not allowing us to reach some people. But then we could not stop at that just because the terrain was not good. For a venue that was not accessible, we had to change some things. We had to move to other places or spaces or grounds that are suitable or friendly and accessible to the persons with disability. So it is not, I'm just trying to say that it needs patience, it needs open-mindedness, it needs flexibility for us to be flexible enough to allow this work to bear the fruits that we want it to bear as we enrich the lives of women with disability. Another lesson is on norms. Like I said, it requires repetition on changing these cultural norms and harmful cultural practices. It's not something that we've seen that we can, it's not a one-time event that you do it today and you expect the change today. We need to do it over and over again, just even for it to stick to people's mind, for it to be like a lifestyle, for us to not to see a woman with disability and then think about her at that time. If we are able to do this sensitization over and over again, then it sticks in our minds, it sticks in the duty bearers' minds, the ones that we work with, and the women with disabilities are not seen as a burden. Another lesson is the partners. We've noted that we really need to be strategic on the partners that we work with, especially the media. And in the media, we have used and we continue to use the local media, like the local radio stations. Yes, we have the mainstream, those which are at the national level, but we have those village radio stations. And those are the ones which we have seen to be very helpful to pass messages to the people in the society, in the communities, and also having community engagement. And let me say we have really seen the need to have those, like I said, we have the community mobilizers who are also a community resource persons like Charity, who is here, who is going to talk, and also Millicent. We have seen that really work, sensitizing them in the community so that they can be there to speak or to empower other women with disabilities and to move the agenda that we are moving. Yeah, and also think this is very important, just to pausing and reflecting and learning, because sometimes we can be very busy implementing projects, wanting to meet the donors deadlines and all that, but it is important just to at some point to pause and look at the work that we are doing and ask ourselves, is it working? What is not working? How best can we do this? How best can we include women with disabilities? How can we be innovative even when we are working with the duty bearers at the national and even the county level? How best can we work with them, and being ready to learn in the process. Next slide. That was in one of the counties, it's called Makueni County. This is the county governor, the one in the middle, the county governor with the county attorney, because when we work with the counties, as much as yes, we want to go to the communities and the villages, there's the protocol that you at least involve the county government. So we were signing a memorandum of association on how we will work together on issues of disability. So I must say that was really an achievement for us during the implementation of the awesome 5-year program. And out of this, we were able to develop the Makueni County, the Persons with Disability Policy of Makueni County. And again, in this, I must mention that our work with women with disabilities it was very enriching, because they were able to participate in the development of this, give their views even in the public participation forums for this. And for us, that is a very big thing. Next. This should be one of the counties again in Kisii, where we were doing. Yes.
Sorry. I was speaking out loud. I was remembering Kisii. Please continue.
Okay, no problem. Yeah, where we worked very closely on this. Maybe I can mention it at this point. We work very closely with Umoja and Usawa through John in just getting the voices of women, the learnings out of the awesome program, to know how the program has benefited them. And we developed a learning and impact knowledge product, just telling the stories of women with disabilities. Challenges. One is the inaccessible facilities and venues. And even as we talk about inaccessibility, we've also noted that even if a facility is accessible, it must be meaningful. If it is accessible, it must be meaningful to that woman with disability, whether she has a physical disability or she's a woman with short stature, whether she is someone maybe who is blind, it must be meaningful, because like I mentioned earlier, you can go to a facility, and I don't know if this happens even in other countries, where the ramp, yes, there's a ramp, but then the ramp is not accessible. It may either too steep that someone with a wheelchair cannot use it. Yes, or even go to a facility where it's not friendly to someone who is blind in terms of lighting and all that. So one of the challenges we face is the inaccessibility, and it's something that we continue to advocate on. Another one is the goodwill and intentionality, especially from the duty bearers. I think getting someone or a duty bearer who has that goodwill is the first step of winning, and being intentional, just being able to think through the inclusion matter, and it suiting each type of disability. I think that's what we mean by goodwill and the intentionality. Some policies, as we have gone on with our work, we have found that some policies and programs, especially those at the counties, at the national level, some may fail to address the specific disability needs. And let me say that disability, even for women with disability, it's important for us to look at the intersectionality of it. The being a woman first, being a woman, secondly, being a woman with disability. Talk about age, either a young person or an elderly person. We face those discrimination or those injustice in various ways, because of gender, because of disability, because of even the geographical location where a woman comes from, really might make some policies or program not be able to address specific needs. And let me say, it comes even to the type of disability, and I know I've mentioned this in some way. Like some disability, I don't know about in other countries, but from our experience here in Kenya, you'll find that some disability might tell you, we feel like women with physical disabilities are well taken care of, quote unquote. They don't have the gross needs or challenges that we have. Someone might say that people with Down syndrome or with short stature, or those who are deaf, are more challenged. So it's a very, do I say a thin line? Because disability types, we can't be discrimination based on disability types. So the intersectionality, that is, I think, what I'm trying to say. Let's look also at the intersectionality when it comes to women with disability. Another challenge is the harmful cultural practices like female genital mutilation, which are really stuck with some communities. So as I said, it needs time, persistent stigma. I mentioned the intersectional discrimination, which overlap by age, gender, disability, and poverty. And I know many will agree with me, the limited funding. And for this, let me just say that, especially when it comes to the advocacy work with the women in the community, it needs funding, because sometimes, even with as much as, yes, we want the work to go on in our absence, funding is needed even when a case of violence happens. These champions need to move from one place to another. That is money that is required there. And sometimes even for programs maybe which have a specific tenure to run, once it ends, it has ended. So I think it's good to think about even the sustainability and all that. John, am I on time?
Yeah, you're okay. A few more minutes.
Okay, because we can talk about this work. Challenges. Another challenge is the burnout of community advocates. As I said, following up on the GBV cases, reaching out to the county government is also it's not an easy task. There is a way that governments work, and sometimes they want, especially the civil society, to fit into that. What word can I use? They want us to fit into that bureaucracy way of working. So, it's just a matter of being able to work around that and getting allies even in the county government. So I must say it's quite a process. Yeah, for example, even as we were developing the county policies for persons with disability, I think one challenge we really faced is the expectations that we can pay them, even for their sitting allowances, the huge amounts they present to us, which really sometimes didn't make sense, and having to find our way to work with the budget we have. I think that was really quite a challenge. And also the people you have to talk to, the protocol you have to follow. Yeah, it's quite a process and not an easy one. And I think one way we were able to work around this is just to find the people who understand what we are doing, who are our allies, and convincing them to be able to convince even the others in these county offices to be a bit flexible to reach this goal. Another challenge is the safety risk, because even as we engage these women with disabilities, the community leaders, they are at higher risk of violence compared to others. Gatekeepers, we've faced this challenge a lot, even with the persons with disability in the communities, in the villages, people who, quote unquote, who feel they own the disability spaces. So we have really to be clever to know how to work with them, not to leave them aside, because we need them also, just finding our way and being tactic to ensure we are involving them in our work. But this has been a challenge. Do you have another slide? Quickly, practical recommendations, even for us, not for WCC alone, Women Challenge to Challenge, but even for the rest of us, adopting an intersectional approach in our work, ensuring that participation is meaningful, strengthening partnerships, because this work, we cannot do it alone, and also supporting grassroots movements, and tell more stories of women with disability. And I know we are going to hear in a few minutes the stories of 2 women with disabilities. So it's important to allow them to tell their stories, because even as they tell their stories, you'll be able to understand the issues that women with disabilities go through. Next. This is our office, and some of our staff and people that we work with. For those who have not seen Jane is the one sitting with red, yeah, on red and black and gray. Then we have one of our board members there seated with Jane. So yeah, this is our space. This is our working space in Nairobi. Do you have another one? Yeah, this let me mention briefly that we also engage at international level. This was again during the closure of the Awesome program, our learning event where we had worked with different countries. So the book that you see there, it's called Seeds of Change. These are the stories of different partners, including of women with disabilities who have been engaged around East Africa through the Awesome program. So we were able to participate in that. And apart from that, during the past 3 years, we have been participating at the convention, the CSW at New York, being represented by different women with disabilities. Yep. We're done.
That's it. Yeah, no more slides.
Yeah, I think that's what I can say for now, but it's quite a lot on the work that we have done with women with disability. And it's a journey. It has been a journey for us.
Thank you so much. Thank you, Jacky, and thank you to Jane before you. Let me just say welcome to those who've come in as the presentation has been on. We're going to hear now from 2 of the women that WCC works with, and after that we'll still have some time for some discussion. It would be great to hear from other countries. How is the situation with disability inclusion, particularly for women with disabilities where you are? And as I've been saying, please make use of the chat at any point if you want to say something or ask a question, but we'll also have time to interact in a few minutes. So I'd like to welcome Charity, who's not far away from me in Mombasa. Charity, welcome. Hope the rain's not too bad where you are. It's quite heavy here.
Yes. The rains are not too bad here where we are. It's not like Nairobi. Thank you very much for welcoming me in this webinar today. And I really appreciate being in this webinar today. My name's Charity Sahasi. I'm from Mombasa, and with the CBO of Person with Disabilities called Tunaweza. And in this program of WCC, I just want to say that I first appreciate WCC for bringing this program to the grassroots, to persons with disabilities on the grassroots. I really appreciate the women with for Challenge to Challenge. Thank you for bringing this program, which has enlightened us and which has actually empowered us. I was a mobilizer also in this program in Mombasa, where I was mobilizing women with disabilities and bringing them on board so that they get the information. This program, when it started in Mombasa, I was looking for women with disabilities because, you know, in Mombasa, it was not really easy to have women with disability together and work together. So we were in this program when I was looking for women with disabilities on the grassroots. They came in these meetings, and when they came to these meetings, I can say that first of all, myself, I was empowered in this program of WCC because I'm passionate about advocating for persons with disabilities, women with disabilities rights as a woman with disability. And in this program, as a woman with disability, I was really empowered.
Maybe we'll go back to Charity in a moment. Millicent, are you ready to come in? We can.
Yes, I'm ready.
Yeah. Okay. So let's hear a bit from Millicent from Siaya County, the other end of the country, nearer to Uganda. Welcome, Millicent. And then Charity will come back to you as well afterwards.
Okay, thank you. I am Millicent Juma from Siaya County, one of the 47 counties in Kenya. So we are County 041. So Siaya is in the western part of Kenya, and I am a community mobilizer for WCC. So having interacted with WCC has really empowered women in the community, especially, I would say Siaya. Siaya was predominantly men. Men with disabilities are the ones who would be seen, who would say something. But with the coming of friends of WCC, we've seen women with disability come out. And as a community mobilizer, my work was to, or is to, go into like the most remote areas in our county and bring out those women who are otherwise thought to have been left out even in programs. So WCC has enabled us to bring out these women, and I would say that we've been empowered in such a way that we participate in leadership and governance tables. We've been empowered how to speak, and most of us have gained confidence through WCC empowerment. And you'd find us now participating in the budget processes, budget cycle processes. You'd find women with disabilities airing their voices and giving out their priorities in these budget processes. We've also participated in you'd see or find women with disabilities in committees that otherwise we were being left out, or any person would be picked who would not bring like a meaningful participation. So now, having been capacity built and know how to say and bring out our priorities, we have been able to be put on board in boards like hospital boards. You'd find women with disability in school boards. You'd find women with disability even at county level. For example, myself, I represent persons with disability in Siaya County at county level in the Committee for Climate Change. So this has happened because of this empowerment with WCC. And when WCC came to Siaya, we didn't have like an OPD that was women-led. And I would say after the interactions with WCC, we now have an OPD that is women-led and is really doing it, like replicating what WCC has capacity built us on. So even if WCC is not in Siaya, there's some work that is still going on under the guidance of WCC through this organization, which is called Friends of Siaya Disability Organization. So WCC having enabled us, we've also formed affiliate member groups, even into the grassroots. So find the presence of WCC empowerment even in all the 6 sub-counties. Like Jacky said, that our counties are formed with sub-counties. So Siaya has 6 sub-counties, which is going to be 9 come the next year of election. So you'd find WCC empowerment in all these 6 counties. We've been taught on resource mobilization. So we can now sit down as women with disability in our various organizations and do resource mobilization, even domestic resource mobilization, so that we are sustainable even in what we are doing. We've also been taught on monitoring and evaluation policies. So we've tried to incorporate everything that WCC has been training us on or capacity building us on. So we've done all those, and it's evident when you come to Siaya, you'd see and you'd find women with disabilities speaking boldly even about the policies, and that's why you see we have the confidence even when we go for these public participations. We know our problems and we present them as our problems, and we have the solutions, and we know those priorities. So it's been a journey for us as women in the rural, because Siaya is rural, especially those who are coming from the interior. So we've grown with WCC. We've seen our women going to be screened for cervical cancer, and it's a plus because even the county government has not done that. So we've seen WCC doing that, and women are happy even when they access the hospitals because there's a ramp that is friendly, like Jacky had said. We advocate for those accessible ramps. We advocate for accessible rooms for wheelchair users. We've also advocated for like sign language interpreters. And also, before I forget, we've also advocated for reasonable accommodation for our young girls with disabilities who are accessing the family planning commodities. Before that, it was not easy even to find women or young girls going for these services. But through the sensitization and creation of awareness for WCC, we find women now and hospitals recording. We've also urged or encourage the hospitals to, at least, even if it is not in their policy, because that's the excuse they tell us, that it's not in their policy, they don't have tools that they can be able to disaggregate data. But we have even provided, there's a dispensary that we gave them a notebook so that they may write the names of those women or girls with disabilities who are accessing the FP commodities and their types of disabilities, so that we may know who is accessing what and at what point do they access. So that has been enabled also through WCC, and also participating in, I'm repeating. Anyway, we've participated in various platforms, and WCC has really come out strongly for us, women with disabilities. And like I said, through WCC, we were able to revive these Friends of Sierra Disability Organization that had been dormant. But after civic education and knowing our rights as women with disability, we revived this organization, and we call it a mini WCC in Sierra. So yes, we have been empowered, and we are claiming our spaces and saying that there's nothing that is going to be decided for us unless we are on those decision-making tables. So that's what is happening in Sierra, and we are really grateful for WCC having to consider Sierra as a priority county for their projects. Thank you.
Thank you so much, Melissa. And yeah, there's a lot of stories as people have been saying. So I've just put the Facebook page for Friends of CI Disability Organisation where Millicent is based. And I must say, it's one of the great things that WCC does very effectively, working with local partners in different places and helping to strengthen the organisations as well as the individuals, as you've heard. Okay, let's go back to Charity and hear a bit more. Charity.
Okay. I'm sorry for what happened.
Okay.
As I said, I'm Charity Chahase. Hello? I'm Charity Chahase. I work. Yes, John?
No, go ahead. We can hear you.
Okay, I'm Charity Chahase. I work for CBO of Women with Disabilities called Tunaweza. I'm situated in Mombasa. And as I said, when
oh dear, I think we've lost her. Okay, I was just putting in the chat anyway, the Tunaweza where Charity is based. They have a very interesting YouTube channel. You get all kinds of interesting little bits, practical things that they're doing, and advocacy type videos, all kinds of things. So please have a look at that. Okay, so if Charity comes back, we'll hear a bit more from her. But now it's time, we've still got half an hour, so maybe we can have about 15, 20 minutes to interact. So I'm going to ask if anybody has any questions or comments, or maybe you have your own experiences you'd like to share. So the floor is open, please. Let's hear from others now. You can just open your mic, put your hand up if you want. Floor is open. But one thing I was suggesting is it would be nice also to hear how is the situation for women with disabilities in some other countries as well. Fasil, please go ahead.
Hi, John. Thank you. My name is Fasil. I joined you from Addis. I have had the opportunity to once see the work Tunaweza were doing when we had a meeting in Mombasa, and it was really encouraging. And the question I have is about the future. What could be done so that these challenges women, especially women with disabilities, are facing in African countries, and the fact that you have such organizations is something very important. But the question is, what are the positive things that are happening to change the situation?
Okay, thanks for the question, Fasil, and thanks for being here. So I don't know who'd like to respond to that. Any of you? Good, Jacky, Jane, Millicent, and Charity's just come back as well. What does the future hold for women with disabilities, and how can the barriers continue to be reduced? Jane, please.
Yes, John, and thank you for the question. And I think all of us have an answer, and that's why we are having this conversation of inclusion, because the work of disability has left mainly to the OPDs, that is organizations of persons with disabilities. But what happens is that every year, is it every or every second year, there is a Global Disability Summit that takes place. Last year, it was somewhere in Germany. And Kenya started hosting it. And so there's so many promises or commitments that the state parties come up with. So once they fulfill these promises, because partly is also to protect women with disabilities, once we implement our laws and policies fully, then there is quite a lot, because even at the region level, we have the Maputo Protocol that speaks on persons with disabilities. We have People's Human Rights Charter that also talks about disability and protecting persons with disabilities, enhancing their work capacity, building them, and issues of participation and inclusion is spoken by these laws and policies. So for me is that everyone should take part into the disability work. And we talk about inclusion. We are saying that it is also in our programming. If we continue those who are running different programs, including persons with disabilities there, then a lot will happen and will take place. And fulfilling some of these commitments that our state parties are committing into. Thank you.
Thank you, Jane. Would anybody else like to add to that?
Yeah. Oh, sorry.
Oh, yes, Saratu, please go ahead.
Okay, thank you, everybody. I am very happy to listen to the presentation, although I joined in a couple of minutes late. I have a question about accessible toilets. I don't know if you can describe what an accessible toilet is, and maybe some checklist of what should be included in an accessible toilet. And if you can have some pictures too that can give us an idea of a toilet that is accessible for different types of disability.
Thanks for the question, Salatu. Millicent, I suggest you answer that. You're the one who talked about toilets and hospital facilities.
Yeah, okay. When we say an accessible toilet, we mean that it should be able to accommodate each type of disability, the physical disability, one who uses a crutch, and a wheelchair user, which means that the doors must be wide open enough for a wheelchair to navigate through. The rails, there should be rails on the sides for support in the toilet. And the floors should also be friendly. That is, you do not put like slippery, this floor should not be slippery, but it should be like with a texture that is not slippery for anybody who can sleep. Yeah, and it should be spacious. The doors must be wide open, not your normal doors, but a door that can be opened from both sides. Yeah, and it opens going outwards, not going inwards. And when you access it, it must have like a ramp. Not you find that some toilets there'll be steps. So when you put a step, then you have left the person who's using a wheelchair out. They cannot use that toilet. So it has to be friendly. And if there's need to have signage, let it be signage that a deaf person can access, and also maybe a blind person with a guide can also use the toilet. So it has to accommodate all disabilities, not just one disability. Yeah.
Okay.
And maybe to add on that, what Millicent is saying, to embrace the universal design. And what we mean by universal is that there is that standard that universally is provided. And once we use that, it will be comfortable for everybody, including those without disability, those with disabilities. And it's also important to keep it clean, because for us, we don't only sit, we touch it, we hold on to it. Even a blind person will want to touch and feel where it is before they use. So that is also very key for us, the cleanliness. Yeah.
Thank you very much for your responses.
May I add something, John?
Yes, please. Please, Jacky. Go ahead.
Very quickly, I think this is usually forgotten. The gender when it comes to the disability toilets. I think in most places, and we see this even in Kenya and in most facilities, having a toilet for women with disability and having another one for men, because you'll find in most cases it's a disability friendly for everyone, like for both men with disability and women with disability. So I think it's also a step, we should go a step forward. It's the same way we have a toilet for different gender, let's have the same for the persons with disability.
Yeah, thank you. That's very important. Yeah, thank you. Thanks, Jacky.
Yeah.
We've got a question in the chat from Paul in Ghana. He says, I want to find out if there is any national disability inclusion guidelines for health service delivery in Kenya to streamline disability inclusion. Somebody like to answer that? What disability inclusion guidelines are there for health service delivery?
Yeah.
Sorry.
Standing alone, we don't have a standalone.
For health services, we don't have standing alone guidelines, but we have mainstreaming guidelines that were once done by VSO, Volunteer Services Overseas, and I think also National Council have some guidelines. National Council for Persons with Disabilities have guidelines on mainstreaming. And it's only that now we started moving away from mainstreaming to inclusion. because mainstreaming is like now having programs for persons with disabilities vis-a-vis inclusion, where we want to bring the person with the disability into the center and then address all the barriers, address the community, the society, the norms, everything. And then the person is also within that environment. The ecosystem also really takes care of disability. So there are those guidelines, but not specifically for health.
Okay. All right, thanks for that, Jane. I'd like to go back to Charity now she's with us, and let's just hear from her for a few minutes, and then we'll still have a little bit more time. I know we've got people from Ethiopia and Nigeria and Ghana and some others. Maybe you could share a little bit about how is the situation in your countries after we've heard from Charity, if you wish. Not to put anybody on the spot. Charity, back to you. Sorry for all the.
Okay, thank you. My apologies. I just want to share quickly about my county, sub-county, and county Mombasa, where WCC came. And as I have said earlier, that I was a mobilizer for the program of the WCC in Mombasa. And as I said earlier also that I really appreciate WCC for bringing this program down to Mombasa and to the grassroots in Mombasa, and also to bring the program to the grassroots, the women with disabilities, just to come together and share ideas and learn more and be empowered. So in Mombasa, by then, we didn't have that network of women with disabilities, like women with disabilities come together. We had no meetings of women with disabilities come together and work together and, sharing ideas together and being empowered together. But this is what something that WCC did. And actually we formed a network of women with disabilities in Mombasa. Now we have that network of women with disabilities in Mombasa. This is because of the empowerment of Women Challenge to Challenge. So we have that network where actually we are in Mombasa sharing those ideas of everything about women with disabilities. Then again, this program has empowered women with disabilities in Mombasa. Most of the women with disabilities didn't know how to talk, how to go and ask even from the offices what they need, what to talk and what to talk. They didn't know. But now we have women with disabilities having in different committees, in most of them in school board of management, in hospitals board of management. Some are in different organizations, board of management, the different networks. They lead those networks and those board of management. Then again, by that time also, women with disabilities in Mombasa County increased because we had most of the men that were working at the Mombasa County, but now we have women with disabilities working at the Mombasa County. And that is the empowerment of Women Challenge to Challenge. As before I told you, we didn't have those meetings of women with disabilities. Again, in advocating for the rights of women with disabilities, as WTCC taught us and empowered us. Actually, we had demonstration about the policies of disability, accessibility to buildings, accessibility to services and buildings. And that was the empowerment for WCC, because we didn't have the courage and the capacity to do that. But because of that, we had people on board, other people on board, they came on board to support us to do that. And we took the petitions, and now the petition is the third reading at the Senate accessibility of buildings. And this is because of the empowerment of women, talent to challenge, because they empowered us to be strong and speak out. And we had the sitting at, last week we had the sitting with the Senate at Friday Paradise here in Mombasa. And then we'll be having a third sitting in Nairobi in the Senate when they will, when everything will be done that time. And this is the empowerment of women challenge to challenge, that we had to speak out and we had to do that, and something is coming out good from that. And actually I lead the delegation of all those who are going with me to the Senate, and I'm a woman with disability, so it is very good. Another thing is about the women with disabilities and gender-based violence. Most of the women with disabilities were being violated, sexually harassed, sexually abused, but because of the empowerment and the training, you know, that has actually reduced, because now they are empowered. Now, if you are violated sexually or harassed, you have to go this way and this way. You have to report in different places. So some also even report to me that they are being where can I go? But they didn't have that knowledge that I have sexually harassed, I'm sexually abused. I have to go to.
Every day,
Yeah.
people juggle so many different tools.
And to get also, hello. Concerning other leaderships, we have networks of Mombasa networks of climate change, Mombasa network, and we women with disabilities also are in that network of Mombasa County Climate Network, and different networks. And another thing that the women with disabilities have done is actually having different businesses, because women with disability, when you are empowered, you need to do something. So they have, because of the empowerment, disabilities have started small businesses that most of them are not going to the street to beg, because most of them are going to beg with their children on the street. But now, because of the empowerment, I see that the women with disabilities are actually now empowered. They can do something to get their living. I think WCC has done a lot to us in Mombasa as women with disabilities. And through the network that we formed because of the WCC, we know that the program will, we pray, we know that even if the program ends, there is a network that has been formed through the program. And also we pray that WCC to have, they should be have more programs for women with disabilities, just to continue with the work that they have been doing. Because one thing I just ask is that we need to push for the women disability policy. That is what I just put for WCC, that we need to have the women disability policy and push for that, so that issues of women disabilities are not just taken lightly. So that is what I can share for now. And thank you, WCC. God bless you.
Thank you so much, Charity. And, great to hear more. And I'm glad that the connection has worked out finally. There's a lot of stuff coming up in the chat. People have been sharing all kinds of links, which is very helpful. I know, Jessica, you usually do a great job at saving and sharing the links as well as the recording. Yeah, I think maybe let's just have one or two final comments. You know, anybody who'd like to share anything else, or if there's a final question as we start to wrap up in a few minutes' time. Would anybody else like to come in? Okay, this sounds like a natural pause. So, you know, I'd like to thank all the presenters. It's been great to hear so many more stories and about the impact that you've been having. It's been fantastic. one of the things that came up in the chat was about the Persons with Disabilities Act, which was passed in Kenya 2025, a very progressive piece of legislation championed by Crystal Asige, who's a senator who's also blind, and she really did a great job. But not just her, large number of people within the disability movement in Kenya, and that's a real big step forward. But as was mentioned earlier, implementation is always the challenge. So well done to WCC and to Friends of CIA and to Noeza, because you're doing a lot of the implementation that probably government should be doing it, but you're finding a way to do it, which is wonderful. Maybe we can just appreciate the whole team. Thank you so much for everything, and for such great presentations. I'm going to hand back to Daniel now to wrap up and to mention one or two things. Oh, Jacky, did you want to have a final word? Please do. See, your hand is up. Please do, Jacky.
Yeah, I wanted to say thank you for considering us, especially you, John, and for working with us throughout those years. Can you hear me?
Yeah, sure. Thank you. Yeah.
Yeah,
well,
thank you so much. I must say that.
Go on.
Yeah, I think my internet is acting up, but I wanted to say thank you so much, and particularly to John for all the support that you've given WCC over the years. Even I think we learned a lot from you in the social inclusion trainings that you offered us. Yeah, and helping us with our gender equality, the GESI. Yeah, I think I cannot just let this go without me mentioning that. So we are really grateful for IACD for this opportunity, and we are looking forward to more and more engagement. And I think we will have a side discussion with Jane to see maybe on how we can join the network. Thank you so much.
Oh, that would be wonderful. Thank you, Jacky. Yeah, welcome aboard to IACD. All or any of you, more than welcome. My pleasure. It's been wonderful to work with WCC. Always is. And it's great to have you here in this forum. So yeah, with that, let me pass back to Daniel. He's going to tell us about the next session. These are monthly webinars and a few other things, I'm sure. Back to you, Daniel.
Okay, thank you, John. And can we appreciate John for wonderful facilitation? He's made life very easy for us, navigating through an interesting discussion. And when we are talking about stories of change, these are the stories that go into the core of transforming people's lives. It's very easy to talk about some of these things, to put them in documentation. And Saratu asked, what exactly does it mean to have a washroom that is appropriate for a person with disability? And until you get to those kind of practical questions, well, some of all this becomes quite theoretical. I'm in a board with one of our members who is a lady living with disability, and we went to a hospital setting and we were shown the washroom that was supposed to be a person with disability friendly. The starting point was the ramp. On a wheelchair, she was rocking backwards, so she could not even climb into the offices, leave alone to the washroom. Then the washroom, the support gear, she just pulled it out. That's what was supposed to carry her. She managed just to pull it out and told them, this one is already a risk. But these are things that can easily be taken for granted. And so when the discussion comes from real life lived experiences, it makes all the difference. And thanks so much, Jacky and team, for leading in this discussion and to help us improve on our processes in seminars and the rest of the meetings. We've shared a link on a smart survey link. If you can just take a few minutes and fill in, giving your just views, that will go in a long way in making us be able to serve you better and to make the ICD processes a lot more user-friendly to all of us. The next edition is focused on students of community development. We are borrowing the theme from the World Community Development Conference in June, community development in a chaotic world, but this time students' perspective. We have lined up students from about 5 universities across Africa. We hope all of them will be able to come up, but welcome on April 8th for that discussion. I've talked about the World Community Development Conference happening in June. The early bird registration closes on 16th. And then, of course, we now go to the normal registration process. You are welcome, and purpose to come to Glasgow, and we figure out how to navigate and make the world a better place despite all the challenges that they are in. We don't know what is going to happen with now the conflict in the Middle East, and that again is going to have a lot of implications going forward. For those who are not members of IACD, we have shared out the link. From the little that you've seen, it's a platform where we are able to connect and discuss things that make sense to all of us on a day-to-day basis, and bringing a process of change to one individual in a community, to one community village, to one city, state, and all that, so that ultimately we can make a difference globally. And so, unless there is anybody with any question, comment, I think we can bring this session to an end. And thank you all for making time for this edition of our IACD webinar series. In my counting from Sub-Saharan Africa, this is the 57th edition. So April will be going to the 58th edition. Thank you so much for making it this far. If you have a topic of interest, just come forth, we'll schedule you, and you can take the platform and lead in the discussion. Thank you so much, and have the best of the day, whatever time you are. Bye-bye.
Thank you very
Thanks,
much.
everyone. See you next time. Thank you. Bye.
Share the links to our email, please.
Oh,
Yes,
sure,
we'll do
yeah.
that.
Bye.
No problem. Thanks so much.
Bye bye, everyone.
Bye-bye.
Bye.
Bye. Bye.